this week's gathering of the Conservative Party's brightest and boldest saw a number of Conservative MPs praising the work of our man Wes, which, whilst not surprising, is a little bit worrying again. This week, the Tory MP for Mid Norfolk, George Freeman, was asked his thoughts on Streeting's plans at a fringe conference around life sciences. He said, the new government have made it very clear that there's a lot of continuity. I'm pretty cheered. So that's great. I'm talking to Keir and Peter Kyle and others. They've been kind enough to say that this is one of the areas they don't view as part of the broken inheritance. Maya, I personally feel loads better knowing that George, the Tory MP, feels that there's loads of continuity from the Tory government to the Labour government. On a scale of 1 to change, is this the change that you were hoping for?
No, but I didn't have a lot of hope with Labour having the NHS because it was actually under the Blair administration where they first started to privatise areas of the NHS. They started with cleaning services. And yes, the NHS was the best in the world at 2010. And so, it looks like, okay, we'll go back to the same party, we'll go back there. But unfortunately, when you look at the stuff that comes out of Wes Streeting's mouth, it is not it. It is not what we are looking for. He seems to think that we can tinker around the edges and we can just tech our way out of the NHS crisis. It's not groundbreaking to say that we should not be working on a half analog, half digital NHS when most primary care is also mostly analog still. So it's not like a breaking news thing to think that digitalizing the NHS services will make things more efficient. Yes.
I just thought about that. Have we considered the internet?
We're doing carrier pigeon at the moment, maybe in 10 years.
Damn it, he's just innovating. He just doesn't stop innovating, this guy.
I know, exactly. I mean, the issues with the NHS are workers' rights, retention and recruitment, the fact that hospitals are crumbling, and generally, if you're talking about public health, only 20% of the public's health is determined by healthcare. The 80% is affected by wider determinants, which we call the social determinants of health. So it's things like housing, it's environmental factors. Do you live near a motorway? Do you live near like those sort of things? If you really want to tackle NHS waiting lists, if you really want to tackle the crisis in social care, you need to look at all the factors that are making people unwell. Stress is one of the primary causes of avoidable illness. Well, let's think about what causes stress. Like, if you actually want to solve the issues with the NHS, you need to look at these sort of things. And I don't think anybody's ready for the conversation of how do we stop the population being so stressed, because people immediately think, that means a worse economy. No, less stress workers mean less sick days, more productive workers. So healthy people, healthy lives, productive workers, growth of GDP.
I think Wes on his own has messed with my blood pressure.
If he has one hater, it is me. I honestly, there's nothing that makes me more frothing than Wes Streeting. And, there are multiple factors why, but also, the rampant transphobia that just constantly gushes from his mouth. Like, you can't talk about having trans women on wards and wanting to have single sex wards if there are not enough wards for patients and patients are in the corridor. You know who's not getting a single sex ward? All the patients are in the corridors.
Yeah.
All the patients are in that hospital, in the ambulances outside.
That would be so Wes, though, to be single sex corridors.
Yeah, it would
single
be.
Sex there is a there is a good good comment from Charlotte in the chat saying, to be fair, tech done badly is worse than no tech, and we've been burned in the UK by test and trace. Based on Wes's recent paying for admission into Parliament, people talking mates rates and things like that with his outstanding businessman friends, I am a little bit wary of him potentially not driving the most successful innovation, maybe not bringing on the best people for the job when it comes to trying to digitize the NHS.
Or also that he has accepted record amounts of donations from private health companies.
Yes.
And also, do you remember Palantir, who bought our data?
I forgot about Palantir.
This is like my special subject. So
I
I
always forget about Palantir. And
never
Brandox.
forget.
Brandox are still doing stuff. I've seen them.
Yes. And generally, when it comes to all things in the UK, all roads when it comes to privatisation lead back to Serco. So there's lots of layers to it. He seems to think that the private sector can unlock some kind of capacity, which is exactly what the Tories did. But I just want to make the really firm point that the private sector does not have the answers. The private sector doesn't have an A&E. They poach all of the healthcare workers that are trained publicly. There's never going to be if you run a health service, a for-profit model is never going to be better than a not-for-profit model. You need all of the resources to go back in. Like the last time I felt patriotic was during the Olympic opening ceremonies where we showed the creation of the NHS, because I think it's the most incredible thing in the world. And so to see that amazing idea that genuinely came out of this decade of national renewal rhetoric that has come out of Starmer's mouth, which is meant to be mirroring what happened after the Second World War. You need to have a fully socialized medical system where you need to increase the capacity. Outsourcing things to the private sector that charge you twice as much for not the same standard of job is not going to help. If you give birth privately and you have a complication during labor, you're taken to an NHS hospital.
Yeah.
So the private sector get all the easy things, and the NHS got lumbered with all the complicated things. So yeah, the answer is in bringing it all back in-house, paying people the same amount that they would get in the private sector to genuinely be competitive, restoring the crumbling infrastructure of the NHS hospitals, and then really investing in prevention.
Yeah, it's always scary when a Tory talks about continuity. It's interesting that a lot of the language that we're hearing now around the NHS is not private, it's not funding, it's not economic language, but it's entrepreneurial language that we're seeing a lot of: innovation, competition, dynamic. Like it's almost all of the phrases that you hear on like a job ad when it definitely means that job's going to exploit you. Like, you need to be fast-paced, dynamic growth, fast-moving environment, balance a lot of wear a lot of hats. It feels like there's a lot of that going on in the wording that we're seeing at the moment, which will essentially, as it does with these job ads, kind of just boil back down to having a really incompetent boss and a really unfair amount of expectation placed on you.
And Robert Jenrick is a big fan of Wes Streeting, which that should just be the review. Like, that should just be all that we need to know, is if he's endorsed by Robert Jenrick, it's not a good thing.
Who's in like a competition to be the worst guy.
Yeah.
Just trying to win the worst guy award. Robert Thatcher Jenrick at the moment.
Who's always too busy because he's painting over murals so that nobody actually feels welcome.
What are you going to do, Maya?
We need the adults back in the room, and we are the adults.
We need the adults out of the room. Get them out of this room. They're keeping coming into the room and being really weird.
Yeah.
Yeah. I think there's a couple of good comments for us to look at here as well. In terms of some of these are serious and helpful, and a couple of them are a little bit silly. We've had Ali say, as though delayed train wasn't stressing me out enough, now we're talking about that cokehead. When it comes to that, we've got Frank Hester owns System 1, which is the most commonly used GP software. For anyone who can't remember, is Frank Hester the one who said that he thinks Diane Abbott should be shot? Yep, that's Frank. Fantastic. We have then also a good comment here from Flow Snake. I think that's the idea. They flood the zone with disasters, crap, dead cats, in the hope that we'll forget about things like Palantir.
Yes. I mean, we should all be disgusted that it's been 5 years, probably about 5 years, I'm not exactly sure, where we have had the safe staffing saves lives posters all over the hospitals. Safe staffing obviously saves lives, but it also protects healthcare workers. We have, like, the rate of suicide amongst healthcare workers in the UK is at an all-time high. it is I can't remember what the figure is, but it's at least one doctor every 2 weeks takes their own life. It's at least that, if not more. It's not just about pay. It's about making sure that our health service isn't actively traumatizing patients and the people who work there.
Mm-hmm. I think, yeah, one more comment in from Charlotte. I watched my Servo colleagues face the same danger as I did in COVID and get shafted if they got sick. There are so many NHS workers who have these stories of, especially during COVID, just being people are traumatized. These workers are completely traumatized. And what was the headline that you shared with me earlier today of people being asked to come back to work to make up hours?
Yeah. So they are now putting in, they want to station like the people who usually work at the job centre in hospitals because of people who are always on long-term sick. So I get the idea. They're like,
oh, for the patients.
Yeah, they're like, oh, the long-term sick, where do they hang out? The hospital. That's where we put job coach. Are you serious? Do you know what people are doing at the hospital? Oh, yeah, I'll have my cancer treatment at 10 and then I'll pop to the job centre in the hospital at 3.
Just to cost. I didn't understand that story. I thought you were talking about for the staff. I didn't even realise that we were talking about shuffling over to the bedside
I had
of someone long-term sick.
Yeah, I had thought that as well. And then I looked at a few of them and I was like, oh, no. Oh, no, they mean the disabled.
That is absolutely horrifying news.
Yeah. So it's like, oh, no, you're too sick to get to the job centre. Ha ha.
Let me know, I'll come to you.
Yeah, doesn't matter.
Oh
I see you, we'll be there.
Scooching over to someone's bedside with like a little clipboard going, well, what are your skills, do you think?
Yeah.
Wake up.
Have you ever thought about working from home, maybe?
Oh my God. Well, and also, given the state of the current work health system that we do have, it's an absolute shit show anyway. So I feel like the message that we're seeing for a lot of what we're talking about today is really let's focus on fixing the existing things. Maybe before, let's try and get the bare minimum right before we try and progress to getting ourselves to the society where we feel like we can allow assisted dying. Maybe let's get the absolute minimum in for people.
Yeah.
Maybe let's give back the whole bit of colonized land.
And also not like realizing that if people haven't got hope, they're much more likely to turn to something like assisted dying. And especially for people who are disabled and have complex chronic conditions. If you empower people and you support them properly, you can restore that hope. If you give them access to assisted dying, they might not have the chance and there might not be the resources to try and rekindle that hope. And we just don't, it's not a place we want to be.
Support independent media, support social justice that's there on social media. Thank you. Turn left.